Aloha, and again, thank you for having me in your home. We're going to follow up with our talks about hypertension and high blood pressure. And so this episode, we want to deal with some specific herbs and even foods that you can take, not as an alternative per se to whatever medication you're being put on, but as an adjunct. One of the things I always talk about is they use that expression, when diet and fitness is not enough, then you go to that particular drug. And so I believe in that very much so. And so rather than telling people don't take the drug, I'm telling you here's diet and fitness that you can use, be it high blood pressure, be it diabetes. As you get more and more to that diet and fitness, the amount of drug that you have to take will be reduced. Working under medical doctors, you may even be able to come off of the drug. But the diet and fitness is something that you have to develop habits for, whereas to take the drug, you just walk up to the medicine cabinet and pop the pill. So it's a lot easier, and so people say, well, I'd rather just go take the pill than have to actually get up and do something different. But if you start young, if you start little by little, it'll work for you. So going back to high blood pressure, one of the things I like to do in today's world is really use clinical research to explain to people that even though it may be an herb or it may be nutrition, if we can find scientific research that satisfies the Western mindset regarding scientific proof, then that's something that will benefit both people. And if you have scientific research, then you can even bring these things to your medical doctor and say, doctor, this is why I'm drinking this herb along with taking your medicine, or this is why I'm doing this. And at least you let the doctor didn't go to school for herbs, but if you're quoting clinical research, the doctor has to at least respect that research. So one of the things that has been found to be very effective for high blood pressure is an herbal tea called hibiscus. Many people within the Caribbeans refer to it as sorrel. People have drank it for quite some time in Africa and other places. I'll be reading from my new book here on hibiscus. If you go to PubMed is a government online database. And PubMed has several hundred listings regarding this hibiscus tea. One such study highlights the effects of hibiscus tea on blood pressure among Nigerians with mild to moderate hypertension, comparing 4 weeks of those taking lisinopril, which is a drug for hypertension, to those who were on the hibiscus tea. They found, and they gave them the hibiscus tea at approximately 150 milligrams per kilogram of body weight. We in America, a kilogram is 2.2 pounds. And they concluded that the hibiscus tea produced equal blood pressure lowering benefits to that lisinopril without negative side effects. And so there was a clinical study to show that. Another one that they did is they put Nigerians on a hibiscus tea and compared it to another drug called captopril, which is also used for high blood pressure. And again, they found the blood pressure lowering benefits of that hibiscus tea was equal to the captopril and to the lisinopril as far as its effectiveness in lowering the blood pressure. Now, one of the things that for those who are on medications for high blood pressure, usually they will give you one, if not two different pills. One of those pills is always going to be a diuretic, what they refer to as a water pill. And so one of the things that you can do for yourself is to take foods that have more of a diuretic impact. A very simple and common food would be celery. Celery is a diuretic. Celery can be used in all of your foods, your salads. They even make celery seed teas, or even make capsules or tablets with celery seed. That's a natural diuretic that you can always take within your body. Greens, salad greens, we call them salad greens, but greens, be it collard greens, kale, those are found to be excellent for the body in general, but certainly for their blood pressure lowering benefits. Now, you remember we talked before about a low sodium diet. As much as you want a diet low in sodium and salt, you want a diet high in potassium. Most people, you say, what's a food high in potassium? People immediately say bananas. But believe it or not, greens have more potassium than bananas. Potatoes in the skin is a source of potassium. So that potassium balances out the sodium. When you go and you buy food, if you look on the labels, you always want to try to buy foods that have at least 2 times more potassium to sodium. That's one of the biggest things that you can start doing in your shopping, is just start reading the labels. I don't look at calories, but I do look at sodium. You'll find that one of the main sources of sodium in the American diet is bread, pizza. Even many of your ketchup has salt in it, of course. You have so many things that has salt in it. But going back to the greens would be a very effective way of including a food in your diet that will help you with your blood pressure. Now, the people who come from the South, and they talk about, well, we used to eat this, we used to eat that, and we didn't get this, and we didn't get that. But you remember, the people in the South in particular ate greens very often. If not 5 out of 7 days a week, greens were a part of the meal. Collard greens, mustard greens. Kale is kind of more the modern kind of thing. I never really ate kale as a kid coming up. I always ate collard greens as a kid coming up, and that my mother was from the South, and so it's nothing new. All things old comes back again. It makes it the popular thing. Believe it or not, there are places charging $25 a pound for kale, because it's the new yuppie thing. You don't have to go that way. On a very minimal diet for people who are even on food stamps, there are things that you can use, that you can buy, that are relatively inexpensive, that can help your health. You want to avoid the processed meats and the processed foods, because those are high in sodium. So hibiscus tea is a very good tea. But somebody says, can I drink too much? For these studies, the equivalent of 5 tea bags worth of hibiscus tea is considered to be an effective range, and you would drink that twice a day. So it's not like you have to drink 5 tea bags and then another 5 tea bags. 5 tea bags for the day was found to be very effective in terms of comparing the benefits of hibiscus to the high blood pressure drugs. The greens, something that you just want to include in your diet in general. Remembering twice, if not 3 times more potassium to sodium when you buy foods. Even things like potato chips. There are certain potato chips that have more potassium than sodium in it. The barbecue potato chips will usually have more potassium than sodium. Not telling you to go out and buy potato chips, but if you had to, the barbecue potato chips would be a better deal than the regular chips in terms of the amount of salt that you're getting. Talked about it the other time, again, for high blood pressure, believe it or not, more water. More water, more water, more water. When those people that work in senior citizen centers, one of the things that they're always trying to get the seniors to do more of, drink more fluids, drink more water. That is also going to be a way that will help your blood pressure, your complexion. If you're bothered with constipation, just more water, more water, more water. Preferably some form of filtered water as compared to just tap water. Why? Because the tap water may have a certain amount of metals in it. The tap water, many years ago, I had a waterbed back in New York, and I filled the waterbed up. I looked at the waterbed about 3 or 4 weeks later, and you should see how much junk was in that water. And I said, now, wait a minute, I only put water in that bed, but you see how many other things are floating around in there. So the idea is to increase fluids, increase greens, try to drink more hibiscus tea. Thank you. Aloha.